friend of mine brings his girlfriend here this weekend and says, she's been having some pain down her leg. Will you take a look at her? Of course. So she comes in, and I notice right away, she's standing like this. She's completely unweighting the right leg. She's leaning into her left leg. She's just visibly uncomfortable. And so she tells me, I have sciatic pain. It's been diagnosed. I've been to the emergency room twice for pain that was so bad, all I could do was lie on the floor and scream. Wow, and you're here seeing me. But she's done what she can with painkillers, and she's wanting to live a life. She's like, I am an active person. I asked her, what causes pain? She's like, walking, moving around causes me pain. Well, this is what we're about at Align Athlete. People who want to move more are being held back by their bodies. So we start talking, and she's like, I feel best when I'm sitting. All right, let's sit. I get her sitting down, and she is much more comfortable to be able to explain that there are some things in life that seem to really stress the sciatic nerve for her. For her, it's when she sleeps over at her partner's house and she's on a hard bed, and that's causing probably some rotation in the pelvis, some stress at the lumbar spine, some triggering down that sciatic nerve. She also says, if I stand for too long, I'll have some terrible pain down the leg. And these are the things that I was doing that got me into the trouble that sent me to the hospital. So I do some work down the spine. She's got minor things. Some of the vertebrae are stuck in flexion. Some of the vertebrae are stuck in extension and rotation. But we work through those, and she's moving around and feeling like things are moving pretty well. And I know we haven't gotten anywhere near the sciatic nerve. So I asked her to get down onto the table if she's able to. This is the big trick. Like, is she going to be able to lie down on her stomach? Well, put a towel or a blanket underneath someone's hips if you're not sure. That can take some of the pressure off of the hip flexors. And I get her down here and I ask her, can you lift your leg? And she gets her right leg barely off the table. Left leg goes a tiny bit more, but it's not moving either. And that's just a sign glute max is not firing well. So we do the technique that we're known for, the very thing that the Glute Activator is made to do. We work on that sacrum bone, and the sacrum is out of the body, and it's jammed up into the spine in all likelihood. So I take my heel of my hand, and I put it right at the base of the sacrum, and with half a pound to 1 pound of pressure, just hold it there. And I wait for it to move, and I'm patient for a couple of minutes. And I ask her if she has any pain. Any pain, so we stay there. And I feel it's still moving, and so I stay there. And then I wait for it to stop moving, and I check to see if she, again, is able to do that glute extension. And this time, right leg goes to here, left leg goes to here. I think, well, we made some nice progress there. Turn the nerves back on, and we've got the glutes firing. Now we have to teach her some exercise that might help it to stay firing. So I bring her over here, and I like to do a supported squat, holding on just in case something goes wrong, and because you can take some pressure off with your hands. Down to about here, most of the weight in the heels, posture upright, pushing from those heels, squeezing the butt cheeks, trying to get full contraction of the glute max. And as she's doing this, she's like, this feels good. I like this exercise. And so we do about 10 to 15 of those just to remind the glute how to fire and try to encourage it to keep firing for her, so that as she's standing, as she's walking, those things that are causing pain for her, the glute's doing what it needs to do, and the sacrum is in the right position to fire it. It was pretty amazing because she had started off on that left leg, and at this point, she's like, wow, that feels really good. She talked about some other medical issues that might be contributing, but if alignment can help, do alignment. Get your alignment into the right place. If it can give you the freedom to move a little bit more, you have a lot more ability to help yourself with exercise and sleeping better because you're not in pain. So if you'd like to learn more about people like this and more tips for aligning your body and your partner's body, stick with us at this channel.